Today I wanted to talk about hypertension, high blood pressure. It's a very common problem. People tend to think that it is because of salt. It's not salt. Salt is not the culprit here. The culprit can be many, but the most common culprit is insulin resistance. So hypertension, diabetes, heart disease, strokes, dementia, all of these have insulin resistance as their primary driver of the disease process. So insulin resistance on one hand and inflammation on the other. Inflammation can also be caused by insulin resistance. So inflammation can be caused by many other causes, but insulin resistance is again a big part of why there is so much inflammation. So a combination of inflammation and insulin resistance is what causes the changes that happen in diabetes, hypertension, and all of those other diseases that I mentioned earlier. So today I wanted to talk about hypertension, and I'd like to clear the air about salt, because salt is not the culprit. 10% of the population is exquisitely sensitive to salt. Those people will benefit from restricting salt, but they would actually benefit more from reducing their insulin resistance, and for that you'll need to reduce the amount of carbohydrates you take in, you'd need to reduce the amount of calories you take in, you'll have to increase the amount of movement you get, you'll have to get more sunshine, get more vitamin D, you'll have to start breathing through your nose, because if you start breathing through your nose regularly, properly, you get more nitric oxide in your system, and that makes your blood vessels dilate, and that brings down blood pressure. You should get more magnesium in your diet, because if you get magnesium, your blood vessels dilate, your blood vessels relax, and your blood pressure will come down. There are people who have deficiencies in multiple micronutrients and vitamins, which can also cause a high blood pressure. So supplementation, the right kind of supplementation can help with high blood pressure. But the basics are usually simple. Reduce the amount of refined carbohydrates you take, increase the amount of magnesium you take, increase the amount of vitamin D you have, get more sleep, breathe through your nose, try and use stress relaxation techniques, get enough exercise, and your BP comes down. Controlling your salt intake usually doesn't help much. You'll get far more benefits from doing what I spoke about earlier. I will have a separate talk on salt itself and how you should be using it, but that comes later. So I thought I'll start off with saying that salt is not the culprit, is not the main culprit for high blood pressure. There are bigger fish to fry. Thank you.